There's a profound experience that many people go through, a moment when reality seems to shift and everything feels different. But how do you know if this is a spiritual awakening or something else entirely? The line between psychosis and spiritual awakening can be incredibly thin, often leaving those experiencing it confused, worried, and unsure of what's happening. You might feel like you've tapped into a deeper level of understanding, or you may believe you're having visions, hearing voices, or receiving messages from a higher power. But there's a crucial distinction to be made here. Misunderstanding these experiences can lead to serious consequences, both for your mental health and your spiritual journey. Imagine, for a moment, that you are standing on a bridge between two worlds. On one side, there is the tangible, everyday reality that everyone knows. On the other side, there's a realm of deep spiritual connection, a place where intuition, inner guidance, and universal truths are revealed. This bridge is narrow, and crossing it is not without risks. Sometimes, what feels like a profound spiritual experience might actually be a sign of a deeper psychological issue. Other times, a genuine spiritual awakening can be mistaken for a mental health crisis. The question is, how can you tell the difference? Understanding this can mean the difference between healing and suffering, clarity and confusion. When it comes to distinguishing between psychosis and spiritual awakening, the stakes couldn't be higher. Misinterpreting one for the other can lead to devastating consequences. If you're experiencing psychosis but believe it to be a spiritual awakening, you might avoid seeking the help you desperately need. Psychosis is a serious mental health condition that requires professional intervention. Left untreated, it can lead to dangerous behavior, severe distress, and a significant deterioration in quality of life. On the other hand, if you're undergoing a spiritual awakening and it's mistaken for psychosis, you might be medicated or treated in ways that dull your spiritual senses, potentially stunting your spiritual growth. Imagine the impact this misinterpretation can have on your life. If you're truly in the midst of a spiritual awakening, being misunderstood could lead to isolation, confusion, and a deep sense of being lost. You might begin to doubt your experiences, your intuition, and even your sense of self. This doubt can be damaging, leading to a cycle of fear and withdrawal from the very practices that could help you grow spiritually. On the flip side, if psychosis is mistaken for spiritual enlightenment, you might engage in behaviors that are risky or harmful, believing that you are following a divine path. The consequences can be far-reaching, affecting not just your mental health, but also your relationships, your work, and your overall well-being. To navigate this complex issue, it's essential first to understand what psychosis is. Psychosis is a condition that affects the way your brain processes information. It can cause you to lose touch with reality, making it difficult to distinguish what's real from what's not. People experiencing psychosis might see or hear things that aren't there, hallucinations, or hold beliefs that are not based in reality, delusions. These symptoms can be incredibly distressing and often lead to a state of confusion, fear, and anxiety. It's important to recognize that psychosis is not a choice or a sign of weakness, it's a mental health condition that can affect anyone, regardless of their background or spiritual beliefs. The onset of psychosis can be sudden or gradual. It might start with mild symptoms, such as feeling unusually suspicious of others or having strange thoughts that seem out of character. Over time, these symptoms can intensify, leading to a full-blown psychotic episode where the line between reality and fantasy becomes blurred. During a psychotic episode, a person might believe they have special powers, that they're being persecuted, or that they're receiving messages from a higher power. These experiences can be frightening and isolating, often leaving the individual feeling overwhelmed and out of control. It's crucial to understand that psychosis is a medical condition. It often requires treatment with medication, therapy, and support from mental health professionals. Early intervention is key to managing the symptoms and improving outcomes. If you or someone you know is experiencing symptoms of psychosis, seeking professional help is vital. While the experiences might feel spiritual or profound, they can also be a sign that something is wrong and needs to be addressed with the appropriate care. On the other side of the bridge lies the realm of spiritual awakening. A spiritual awakening is often described as a profound realization of the deeper truths of existence. It's an experience that can feel as though the veil of ordinary reality has been lifted, revealing the interconnectedness of all things, the presence of a higher power, and the eternal nature of the soul. During a spiritual awakening, individuals might feel an overwhelming sense of peace, love, and understanding. They might also experience heightened intuition, vivid dreams, or a strong sense of purpose. Unlike psychosis, which is characterized by confusion and disconnection, a spiritual awakening typically brings clarity, insight, and a deep sense of connection to the universe. However, a spiritual awakening is not always a smooth or peaceful process. It can be accompanied by intense emotions, existential crises, and even physical symptoms as the body and mind adjust to a new level of awareness. This process, often referred to as a dark night of the soul, can be challenging and may feel disorienting. But rather than being a sign of mental illness, these experiences are often a natural part of the spiritual journey, a necessary phase of breaking down old patterns and beliefs to make way for a new understanding of reality. Spiritual awakenings can vary greatly from person to person. Some might experience a sudden, life-altering event that triggers their awakening, while others might go through a more gradual process. What's common among these experiences is the profound sense of change and transformation. People often report feeling as though they've woken up from a long sleep, seeing the world with new eyes and understanding life on a much deeper level. These changes can be both exhilarating and unsettling, but they are generally accompanied by a sense of inner peace and a newfound purpose in life. Given the overlapping symptoms, distinguishing between psychosis and spiritual awakening can be challenging. However, there are key differences that can help in making this distinction. One of the primary differences is the overall impact on the individual's life. In cases of psychosis, the experiences often lead to significant distress, confusion, and dysfunction. The person might struggle to maintain relationships, perform daily tasks, or make sense of their thoughts and experiences. There is usually a sense of fear, paranoia, or persecution, and the experiences tend to be chaotic and fragmented. In contrast, a spiritual awakening, despite its intensity, often leads to a greater sense of peace, clarity, and purpose. The individual may feel more connected to others, more aligned with their true self, and more in tune with the rhythms of life. Even during challenging phases of the awakening, there is usually an underlying sense of growth and expansion, rather than disintegration or despair. The experiences in a spiritual awakening are typically coherent and meaningful, providing the individual with insights that resonate deeply with their inner truth. Another important difference lies in the nature of the experiences themselves. In psychosis, the experiences often feel disjointed and disconnected from reality, with thoughts and perceptions that don't align with the consensus view of the world. Hallucinations and delusions in psychosis can be frightening and alienating, making it difficult for the person to trust themselves or others. On the other hand, during a spiritual awakening, the experiences, although sometimes unconventional, generally feel more integrated into a broader understanding of life. The insights gained are often transformative, leading to positive changes in behavior, relationships, and self-perception. It's also worth noting that in a spiritual awakening, the individual usually maintains some level of self-awareness. They might question their experiences, seek guidance, and explore various spiritual practices to better understand what they're going through. In psychosis, however, self-awareness is often diminished, and the person may be unable to critically evaluate their experiences or recognize when something is wrong. This lack of insight is one of the hallmarks of psychosis and a key factor in differentiating it from a spiritual awakening. Given the complexities involved in distinguishing between psychosis and spiritual awakening, the role of mental health professionals cannot be overstated. These professionals are trained to assess, diagnose, and treat mental health conditions, including psychosis. They can provide valuable insight into whether the experiences you or a loved one are having are more likely to be related to a mental health issue or a spiritual awakening. This assessment is crucial because it guides the appropriate treatment and support needed to ensure well-being. Mental health professionals use a variety of tools and techniques to make this distinction. They might conduct interviews, administer psychological tests, and gather information from family members or friends to get a complete picture of the individual's mental state. They look for signs that are characteristic of psychosis, such as disorganized thinking, lack of insight, and impaired functioning. They also consider the context in which these experiences are happening, including any recent stressors, trauma, or substance use, which can sometimes trigger psychotic episodes. At the same time, many mental health professionals are becoming more aware of the spiritual dimension of human experience. They recognize that not all unusual experiences are pathological and that spiritual awakenings can sometimes present with symptoms that resemble those of mental illness. In such cases, a holistic approach that respects both the psychological and spiritual aspects of the experience is often most effective. This might involve a combination of psychotherapy, spiritual counseling, and supportive practices like meditation or mindfulness. If you suspect that you or someone you know might be experiencing psychosis, it's essential to seek help as soon as possible. Early intervention can make a significant difference in the outcome, helping to manage symptoms and prevent further deterioration. If, on the other hand, you believe you're going through a spiritual awakening, it can still be beneficial to speak with a professional who is open to spiritual perspectives. They can help you navigate the challenges of your awakening while ensuring that you remain grounded and healthy. In some cases, it might be helpful to seek out a mental health professional who specializes in spiritual or transpersonal psychology. These professionals are trained to understand and support spiritual experiences, recognizing the difference between a spiritual crisis and a mental health crisis. They can provide guidance on how to integrate your spiritual awakening into your life in a way that promotes healing, growth, and well-being. Grounding is an essential practice, especially during spiritual experiences or awakenings. When you experience a spiritual awakening, it can feel like your entire world is shifting. You might feel disconnected from your regular routine, relationships, and even your physical body. This is where grounding becomes vital. Grounding techniques help you stay connected to the present moment, your body, and the physical world, which can prevent you from getting lost in the intense experiences of your awakening. Grounding practices can be simple and practical. They include activities like walking barefoot on the earth, practicing mindfulness or meditation, spending time in nature, or even engaging in physical exercise. These practices help anchor you in reality, making it easier to navigate the sometimes overwhelming emotions and thoughts that accompany a spiritual awakening. Grounding also helps you process the insights and realizations that come with awakening, allowing you to integrate them into your daily life in a meaningful way. Without grounding, there's a risk of becoming too absorbed in the spiritual experience, which can lead to feelings of anxiety, confusion, or detachment from reality. Grounding ensures that while you're expanding your spiritual awareness, you remain connected to your everyday responsibilities and relationships. It's a balance that allows you to grow spiritually without losing touch with the practical aspects of your life. Remember, a true spiritual awakening should enhance your life, making you more present, compassionate, and aware, not disconnected or overwhelmed. Supporting someone who is going through either a spiritual awakening or psychosis requires sensitivity, understanding, and compassion. Both experiences can be intense and overwhelming, and the person going through them might feel isolated, confused, or frightened. As a supporter, your role is to provide a safe, non-judgmental space where they can express what they're going through and feel heard and understood. If someone is experiencing a spiritual awakening, they might benefit from gentle encouragement and reassurance. Listen to their experiences without dismissing or pathologizing them. Encourage them to stay grounded and to explore practices that can help them integrate their awakening into their daily life. Suggest they keep a journal, meditate, or seek out a spiritual mentor who can guide them through this process. It's also important to remind them to take care of their physical health during this time, as the mind, body, and spirit are all interconnected. On the other hand, if you suspect that someone is experiencing psychosis, it's important to approach the situation with care. Encourage them to seek professional help and offer to support them in finding the right resources. Do not challenge or argue with their delusions or hallucinations, as this can increase their distress. Instead, focus on being present and supportive, helping them feel safe and understood. If necessary, involve a mental health professional who can provide the appropriate care and intervention. It's crucial to remember that whether someone is going through a spiritual awakening or psychosis, they need your patience and compassion. Both experiences can be isolating, and having a supportive person by their side can make a significant difference. By being there for them without judgment, you can help them navigate their experience, whether it's a journey of spiritual growth or a mental health challenge. Self-awareness is a powerful tool in distinguishing between psychosis and spiritual awakening. It involves the ability to observe your thoughts, emotions, and behaviors objectively, without becoming overwhelmed by them. When you're self-aware, you can step back from your experiences and evaluate them with clarity and discernment. This ability is especially important during times of intense spiritual or psychological change, as it helps you maintain a balanced perspective. During a spiritual awakening, self-awareness allows you to recognize the shifts happening within you while staying connected to the realities of daily life. You can acknowledge your spiritual experiences without losing touch with the physical world, and you can integrate your new insights in a way that enhances your life rather than disrupts it. Practicing mindfulness, meditation, and journaling can enhance self-awareness, helping you stay grounded and focused during your awakening. In contrast, during a psychotic episode, self-awareness might be diminished or altered. However, if you can maintain some level of self-reflection, it can be a sign that you're not entirely disconnected from reality. If you notice that your thoughts or perceptions are becoming increasingly strange or frightening, this awareness can prompt you to seek help before the situation escalates. Self-awareness, in this context, becomes a crucial early warning system, alerting you to the need for professional intervention. By cultivating self-awareness, you empower yourself to navigate your experiences more effectively. Whether you're experiencing a spiritual awakening or struggling with psychosis, being able to reflect on your thoughts and feelings can help you make informed decisions about your well-being and the support you need. In the complex and often confusing journey of life, the ability to discern between psychosis and spiritual awakening is crucial. Both experiences are profound in their own ways, but they require different approaches and levels of care. Understanding the key differences between them can help you navigate your experiences or support others more effectively. Whether you're going through a spiritual awakening, experiencing psychosis, or supporting someone who is, the most important thing is to approach the situation with compassion, understanding, and an open mind. Remember that seeking help from mental health professionals does not diminish your spiritual experiences. Instead, it ensures that you're safe and supported as you explore the depths of your consciousness. Grounding practices, self-awareness, and professional guidance can all play a role in helping you distinguish between these two states, allowing you to grow spiritually while maintaining your mental health. Ultimately, the journey of spiritual awakening or the challenge of psychosis is deeply personal. It's a path that requires courage, self-reflection, and support from those around you. By being mindful of the differences and knowing when to seek help, you can navigate this journey with greater clarity and peace. May your path lead you to deeper understanding, healing, and transformation.